Hey folks, I am Dr. Erika Miley, mental health therapist and ASECT certified clinical sexologist. Welcome to TwoX Labs. Today we are talking about families that have periods of time of estrangement. I don't know about any of you, but I've had so many patients and clients who are experiencing a variety of strained family relationships, especially since the 2016 election. So I brought you my lovely partner in crime here, the chief of curriculum development at TwoX Labs, Dr. Bethany Suppes. Share a bit about your background, my friend, and your expertise in this area.
Absolutely. Hello, everybody. My name is Dr. Bethany Suppes. As I like to say to my students or when I give a presentation, you are welcome to know me as Dr. Bethany, Dr. Suppes, Dr. B, Dr. S, just not Dr. BS. I have a master's and a PhD in marriage and family therapy, lots of experience in different types of outpatient care, and some intensive inpatient working with teens, adults, individuals, romantic relationships, families, but especially families reconnecting after estrangement. I currently have a private practice in Spokane, Washington, where I often work with adult children to reconfigure their relationships with their parents and their siblings, such as learning to cope with different value systems. Erika, as you referenced, that can include faiths, political, parenting styles, just overall philosophies of life differences. That can be hard to manage differences in close and marriage.
I imagine since the 2016 election, but also since COVID, this has been like only filling your practice more and more.
My goodness, it breaks my heart a little how true that is, if I'm completely honest. I've really noticed people do not often know how to have hard conversations in ways that still feel connecting and loving. And that can be very challenging. The meaning making that people give to different values and different political beliefs, kind of the assumptions that a lot of people make with it, is definitely a big part of what I end up talking about in my work with families aiming to reconnect with one another. Because they still want the connection, right? Like, we still love these people. We just don't know how to interact with them anymore once we recognize these differences, or, maybe once we're speaking to these differences. Because something I also see happen frequently is if they, how to describe it? If they've been feeling the difference inside themselves but haven't felt okay to speak to it. So some of my work has particularly been with launching teenagers or launching young adults. And they are now out on their own. They're finally getting to do some of the things that maybe they didn't feel like they could do when they still lived with their family or with the people that raised them. And it hits like a shock for the people that they are separating that space from, because they didn't potentially not know the extent of distress that those differences were causing, or I've even had people that didn't realize there were differences until that launching point too. And with that launching of we're already creating physical space from this person, that additional emotional space can sometimes feel like too much to bear.
I imagine the number of stories that has just pulled at your heart again and again as you watch families, and I imagine found families, a lot of different family configurations. I'm kind of curious, like, what are some of these common reasons that people will decide to cut off loved ones from their lives? It does sound like there is kind of a more likely developmental time period, but are there these common reasons or patterns that you see?
Absolutely. Generally, I would say that it often comes from a place of hurt. That could be broken or absent trust or feelings of betrayal. That could be current or past abuse or neglect, of course. I also often see it be from this place of emotional overwhelm. People that we are in relationship with that maybe we view as dramatic or needy, or people that we feel like might interrupt our autonomy development. or are just autonomous living. I often reframe this for people, that people fill a role for us differently than we think that they should. So think about like the difference between how a parent treats their adult child versus potentially how they treated them as a kid. I remember one of my favorite stories to give it as an example of this is that when I was doing my undergrad, I was a resident assistant in one of the dorms, and there was one of the students on my hall whose mother would come and stay in the dorm with her Thursday night until Monday or Tuesday of the next week. And during that visit, the mother would do her laundry, take her grocery shopping, even though we had a mess hall, of course. And it was very much something that the daughter kind of just passively allowed because she was afraid how her mother would receive her, asking for that timeline to change, or asking her to not stay at all, or asking her to stay at a hotel when she did visit. And of course, like, this was also distressing for the girl's roommate. And so that ended up having to be a conversation between the dorm leadership and this mother, which didn't feel as helpful because of course it still puts that young student who's trying to launch in a rough spot. So like I said, I know that's that launching age is just one age that I see it frequently. But
you're talking about something that like it's resonating with me as a parent. I remember like that so many times as I've grown as a parent that I have had to challenge this thing inside of my children are not direct reflections of me. My children are not little versions of me. They are their own little creatures that are going to become their own little humans. They're going to deal with their own things. And my job isn't to be this person that makes a perfect life for them. My job is to help them navigate the shit show that's coming in the world. But doing that inside as a parent is so difficult, especially if you've never as a parent experienced that or watched your parents do any part of that. If you have no reference for it, how will you know where to go? So I'm kind of curious, like how do some of these cutoffs, or like I've some of my other colleagues say estrangements, it is usually a process. It isn't necessarily, it might feel like a cutoff and it's over for one person, but most of the time it's a process. So how would you say it typically impacts the individual who initiates and the relationships that have been left behind?
Ooh, that is a great question. The biggest difference I notice that it seems to make for people is an extensive amount of grief. They are moving from this very enmeshed and connected relationship with somebody to where, like, potentially they didn't really have an independent identity from this person, which can be marked by features like codependence, that lack of independent thought, feelings, sense of personal needs and relationship, that sort of thing. That there is excitement or even relief to there being new distance. There can also be a lot of fear because they're entering an unknown, and there can be that grief. And with those things can also then come that confusion, right? Of how am I feeling both these, good, air quotes, intentional feelings of, relief and joy and freedoms, while also experiencing this as a loss. That can be really, really overwhelming for people. It can also, like, the type of feelings that somebody has also can really depend on the extent of disengagement that they go to with that person. So like you said, if they've kind of been gradually creating distance from this person already, that can feel different than the abrupt, like, we're going from talking all the time to I am no longer talking to this person, like doing that full arc swing. That can also include, like, even after they cut the person off, if there is still extensive emotional investment in that person. So that might be going to therapy. That could be, are they still participating in gossip about that that space or that person or that relationship? And how much are they also letting themselves lean into things like the joy and that self-exploration of their own interests and values and aspects of identity?
I am kind of curious. I want to bring it home because I know we both are seeing a lot of, the baby therapists coming up in the field, right? Like not baby in age, but new therapists coming up in the field.
Yes.
How would you suggest, because I imagine, I mean, both you and I have worked with families for many years. Like what would you say is to really start to hold that container for those intense emotions? Because you're going to feel what they're feeling, and it's going to feel like your own anxiety quite often, but it's not. It's usually the family members or the person who is trying to manage new boundaries. How would you say like a new therapist or even like a mid-career therapist would start to manage the container of these big feelings with their clients?
I want to make sure I understand your question correctly, because as you describe it, my brain immediately goes in so many different directions. Like as a clinician myself and as a supervisor.
Mm-hmm.
So you're asking, how do therapists hold space for all those different emotions, even the seemingly conflicting ones?
Yes, especially if they're experiencing something in their own story, perhaps.
That is a great question. The two biggies that stand out for me right away reminds me of the difference between empathy and compassion. So empathy is essentially the idea of, I can understand this person's emotion. It's not necessarily a joining them in that emotion, even still holding it separately. It's the ability to understand. And it can, like, empathy can be fantastic, obviously. Like, the ability to understand is by itself such a feat to be able to achieve. It also is something that we in the profession have seen be used for harm. Like, that can be the side that is, I understand you, I know you, which also means I know how to hurt you. And I know that I can set boundaries that aren't about me protecting me, but become about wanting the other person to feel the hurt that I hurt.
Yeah.
And so when I even think about that related to trainees, I really hear this idea of reminding the clinicians, it's not about you. This is not your space. I want you to have that space, but this is your client's space to process their emotions. So if you are noticing yourself have emotions in response to theirs, of course that is normal and healthy. Like, that is that attuning.
Robots.
We are not robots. The blank slate is a lie.
It is a lie.
It is a lie. And at the same time, that's not the space to tell our stories necessarily. Anytime anytime trainees talk about wanting to use self-disclosure, I am totally pro self-disclosure with our clients, as long as it is for the purpose of helping the client, and as long as it shifts focus to the client. Honestly, that's even an example of a professional boundary. I know that's not what we're talking about today, but maybe some other topic down the road. But
whole other hour. We know.
Whole other hour for sure. Yeah, because
I think you're bringing, especially when you're early in the field, of starting to understand the pieces of self-disclosure that can be incredibly helpful and healing, but also when there is an intensity of emotion that we must stay with the client's intensity of emotion and not let our own come into the room in those moments.
Absolutely. And as you describe that too, I think about, like, earlier I made the joke about the blank slate, the idea that the therapist does not bring aspects of themselves into the room. And it reminds me of some more of my, like, professional history around how I really got into this, that when family therapy really started becoming a thing back in, like, the mid to late 20th century, Bowenian therapy, or I should say multi-generational family therapy from Murray Bowen, really had the perspective that cutoffs are bad. Like, he he and his theory really leaned into the idea of you should never fully cut somebody off because that is a reactive thing to do. And therefore, if it's reactive, you are still allowing that person such a degree of influence over your life. And it's not actually a movement of autonomy. I also thought of a model of therapy called internal family systems theory by Dick Schwartz that looks at how cutoffs with parts of ourselves, he does a lot more work on like our internal understanding of ourselves and that making sense of feeling those different things at the same time. But one of the things he talks about is how cutting off parts of ourselves can be very problematic because typically the parts of ourselves that we cut off are viewed as damaging to the image of self, but they actually are very rooted in being scared of being unloved. And we can come back to that kind of as we talk more about boundaries too and how we set those. But there was really like this societal shift that has happened here in the past 10-ish years or so. To where cutoffs are even viewed as necessary to cope with, I'm going to put air quotes up here, toxic people. I intentionally put air quotes there because people's definition of toxic can range so drastically. It can be anything from this person has and continues to, maliciously put me in harmful and dangerous situations to, well, this person is calling me out on some of my own crap and I don't like that. That's where
and there is a fundamental
overwhelm,
difference.
Absolutely.
There's a fundamental difference. And here at TwoX Labs, it's part of our mission to support AFAB people in addition to queer people. And sometimes that cutoff is based on serious danger, psychologically and physically. And so we're talking about something a little different than that. And I think that it's important that we make that distinction, the distinction you're making right now.
Absolutely. I want to distinguish like the thing that I think concerns me as a therapist is seeing this trend of people being quick to cut people off, seemingly from like a lack of options. Like they don't necessarily know how else to address the extent and depth of their emotions related to this person and their relationship with this person, or how to deal with feeling so out of control in that relationship. I often will make the comment to my clients, and honestly, my friends have heard it plenty of times too, that attempts to control are actually just the illusion of control. We do not actually control other people at all. The only things we can control are our behaviors and our thoughts. And even then, let's be real, sometimes that takes a lot of intentionality to be in control of those things and redirecting within ourselves. But it's really influence. We influence each other. And a cutoff is one of the ultimate forms of influencing somebody through intentional silence and space.
One of my OG podcast dads is Dan Savage. And I love Dan's perspective on the only thing that you can control is your own presence. That is it.
Beautifully said. And how you present yourself.
Exactly. That is the only thing that you can control. And it might feel like your body might be telling you when you're going to try to make a new boundary, or when you're going to, and we're going to talk about boundaries here in a moment. But when you go to do that, it might feel like you're going to die, but you will not die. So I am kind of curious. I think it's really important that we tackle some of the things that I imagine that is probably, especially right now, we are doing TwoX Labs in a post-Roe world, right? Like the level of heat in discourse between family members is high most of the time. I know there's a lot of, in my own life, there's a lot of family members that are saying like, no politics talk at all. You may not. Just the end. If we want to spend time together, we're not going to do this. And we're coming up on essentially redoing the 2016 election, which I know we're all exhausted by this. Therapists are exhausted by this. And so I imagine that in the therapy room, it becomes daunting to start to think about, like, what are these boundaries? How do we teach people to create them? And And do you have some examples or some different types of boundaries that our clients and patients can set?
Absolutely. I am a big fan of a 4-step model that I use when talking about boundaries with my clients. Because there are ultimately 3 types of boundaries. If I can just kind of go off on a slight rant behind your question as I answer it. Different people there are a few different theories about how to describe boundaries, I guess you could say. I really think of it as the practice and request for respectful space between a sense of autonomy and a sense of togetherness, or like that connectedness with other people. So the 3 types that I look at are physical boundaries. This, of course, could be anything from needing personal space. It could be boundaries related to physical touch. And of course, sexual boundaries fall into that as well. The second would be mental and emotional or cognitive boundaries. These can be the limits of the extent of intimacy that you offer in your connections, restricting the giving or receiving of thoughts or emotions. And then last are what I call practical boundaries. So this could be anything from the sharing of your materials or your possessions, to also your sharing of time and the time that you dedicate to different things. And this can also relate to the expectation of those being returned, such as like that mutually beneficial experience that people often look for in relationships that feel truly connecting and meaningful. So I like to, whenever I talk about boundaries, I think it's fair to give some examples, if you're okay with that. Because Like I said, so often people reach for cutoffs because they're like, I don't know what else to do. I don't know how to set boundaries. I don't know examples of boundaries that feel like a middle ground. And often because people feel so disrespected already, they want that much more space and distance.
This is why we have ghosting.
100%. Honestly, I kind of consider ghosting a form of cutoffs. My version definitely says cutoffs do not happen by accident. It's not like you people can have relationships that just peter out, right? Like I moved from Texas to Washington as part of my professional growth, and I had people that I saw more often and felt closer to when I lived there. And now that I live far away, and there's a lot more intentionality in those, some relationships haven't lasted through that change. That's not to say that I don't care for those people. It just means distance makes friendships hard.
Yes.
However, things like ghosting and cutoffs are that intentional choice to end a relationship, be that long-term or temporarily, typically conveyed through silence and disengagement, like I said earlier. So yeah, let me come back to my examples. Of course, this can be anything from like leaving a room or a space or ending a phone call. This could be holding boundaries around personal time, such as making sure that you are honoring your weekend to be things that are focused on other relationships compared to professional relationships, for example. This could be not hosting or organizing events for family or for other groups that you're in. This one's not one of my nephew's favorites, but you can end a game when somebody cheats. That's a very specific one that I will convey with him sometimes, unfortunately. This can also be examples of unfollowing somebody on social media, not sharing treasured belongings with other people, like not letting people borrow a specific jewelry item or crafts related to your hobbies that maybe are expensive, that you've seen somebody be disrespectful when they borrow things, maybe not returning it in good condition, that sort of thing. This can also be things like only meeting with somebody in public or for a limited time. Requesting to not be asked or to be asked before physical touch, choosing to not provide information. Again, we don't have time for me to super go into the difference between privacy and secrecy, but I think that those are very, very different things when I talk to people about boundaries as well. And yeah, like I said, cutoffs are also an example of a boundary in that extreme form as well.
Yeah, I am kind of curious. we're going to talk about some the difference between. I want to dive in a little bit into the difference between empathy and compassion as we were talking about it, because there's some, as you're describing these examples, I imagine there's key steps to holding compassionate boundaries with loved ones. But I think, what is the difference between compassion and empathy in these situations? And how do we maybe even teach our clients some of these steps to holding these boundaries?
Absolutely. One of the key differences with boundaries between empathy and respect is reiterating for yourself and potentially even for the other person that boundaries are about setting limits for yourself, not the other person. That's where I was saying, don't set the boundary based on the other person, set the boundary based on your needs. The only thing, like I said, that you can really control is, or that you said, is control of your presence and how you present yourself. You influence other people. You cannot control them. They influence you. They do not control you. Of course it's hard. Of course, the idea of setting and maintaining two separate steps, very, very much so, is incredibly difficult. And it's so important, again, to remind yourself and potentially the other person that boundaries are not a punishment. They are an act of discipline. And I want to pause and clarify what I mean by discipline, because the word discipline actually comes from the Greek word for pupil, which is focused on both learning and teaching effectively, right? So boundaries are meant to be a source of teaching and learning, not threatening. And that's why I'll talk about the 4 steps to setting compassionate boundaries right now.
You're talking about teaching people how to interact with you.
Exactly. You're teaching them what kind of relationship you want to have with them. Not a lack of relationship, but one that allows both people to thrive and to flourish is the hope. And that can mean, hey, we are thriving and flourishing in ways that look different from how it used to. Like the way that I flourish with my sister looks different now than when we were kids. Thank goodness, I would say.
Same.
On the end of that.
Same. I love you, Katie.
Karen, call out. I got you. Okay, so let me kind of hop back to your earlier question about what the 4 steps really are and what those really include that differentiate compassionate boundaries from other types of boundaries, I guess you could say. I don't want to say like empathetic boundaries because I don't necessarily have a specific definition for that, but I'm thinking of like things that I have read where setting the boundary can, or holding and maintaining the boundary can feel very disengaged unto itself. And that's what we're trying to not do. Like,
you're providing yourself empathy in a lot of ways. Like you're providing yourself when you create these compassionate boundaries for other people and you're teaching them how to interact with you. You are essentially holding space for empathy for yourself.
Yeah, I would probably phrase it, because I'm such a stickler, as compassion for yourself. So, because self-compassion is really defined by self-kindness. It's defined by an awareness of yourself in a moment and how you affected the space that you are in and how the space is affecting you. And it's also that ability to be able to know I am having human experiences. Emotions are human experiences. Relationships are human experiences. And while my relationships are unique, I am not alone in the hardships that come with things like setting boundaries and holding boundaries. So as we keep that in the back of our mind, here's the 4 steps of compassionate boundaries. The first is to state the desired boundary. Couple specifiers within this, I'll say. We are phrasing this as a request, not a demand. That can be so scary for people, but that is us acknowledging influence, not control. Because when it's demands, it can sound very controlling. And I don't know about you, Erika, but my experience, both professionally and personally, has taught me people don't really respond well generally to feeling controlled.
My ears turn off.
Exactly. Our ears turn off, and frankly, like a little part of our heart turns off too. Like we don't like the feeling of it because it doesn't feel respectful. So phrasing the desired boundary as a request instead of a demand can help soften that, because that's all we can do is request that the person do what we're about to ask. This can also include identifying the potential mutual benefits, like saying, hey, I want both of us to feel safe and loved through this process. I also find that it can be helpful in those times and spaces to identify your emotions about it. So being able to offer, I know people can have a lot of feelings about the word vulnerability, but being able to offer that, what I would call emotional insight, being able to have that insight to you shows an ongoing interest in feeling connected with this person. You are still offering a piece of yourself while stating this required boundary, or desired boundary. There's something that we can edit in a second. So stating that desired boundary is the first step. The second step is that if that request is ignored or overtly denied, identify what will happen if the offense happens again. So this is the step that I notice a lot of other boundary places hop to too quickly, in my opinion. So this can be phrased as like an if-then statement of, if you do this again, I am going to fill in the blank. Ideally, after doing that, or as part of doing that, you will also identify the next point of contact. So again, reiterating the ongoing connection. So that might be, hey, I try and protect my weekends to be between, me and my partner, me and my kids. I will call you on Monday. And so this is an example of it. And so I am identifying, I will call you. I will reach out to you. And at this step is also so helpful to reiterate, even with the words themselves, if it is relationally appropriate to do so, reiterate the love that is there. Stating, I love you. Stating, I hope that you have a good weekend. Again, we're including, as we set these boundaries, we are including intentional statements of connection within them. The third step, as not fun as it is, follow through as necessary. This is the maintain shift. We're shifting from setting to maintaining. And there's a couple of pieces that I would emphasize here. First is, do what you said you were going to do. You gave them an if-then statement, follow through on the if-then statement. Don't escalate it just because you don't like that they took you up on it. Be true to your word.
Yes.
So this is
I notice,
something
I don't know about you. I notice so many of my patients really struggle with this part. It's less, at least for some of them, it's less about the repeating of the boundary or the maintaining of the boundary. I mean, some people struggle with that too, but they get upset when they have to repeat it.
Absolutely. Yeah. Like there can sometimes be a lack of compassion, I notice, for why it is hard for the other person to receive a boundary. Like, it reminds me of what you were saying earlier, that it could be that the person setting the boundary has been pondering how to do this for so long, but it is brand new information sometimes for the person on the receiving end. And it is very, very normal, of course, for that person to push back, right? Like, that's just them thinking, oh my gosh, connection is what we've previously done. This is, the old version of connection. I want that back. That the idea of a different type of connection might not even occur to them, especially if it does feel threatening and scary to the relationship overall. So I guess all that to say, like, pushback from the person receiving the boundary is very normal. And I would want to offer that to anybody setting a boundary, and exactly what you were describing of thinking, like, why can't they just respect this? Why can't they just honor this thing that I ask of them? And honestly, I tell my clients all the time, let's answer that hypothetical question. Let's answer, why is it hard? Why are they pushing back?
Yes.
And at this stage, when we're following through as necessary, we can either reiterate the current boundary, potentially set a new one, or we can stay silent depending on the situation. Whenever people choose silence, I frequently recommend to let the person know that that's what's happening, because that also is a difference between a cutoff and ghosting in a way. Or between setting compassionate boundaries and ghosting, is that we are not just disappearing into the night. We are saying, hey, I'm not going to respond to your texts until Monday, if I were to continue the previous example. I love you and I'll get back to you then.
Or I think you're making a really good point here about what the absence of time might do to the person who is setting the boundary in addition to the person receiving the boundary. Like when you are verbalizing that, you are managing your own anxiety in addition to giving a gift to that person of helping them know what the expectation is. And I imagine during cutoffs, especially in family relationships, that like the ghosting or the not having any boundaries or the abruptness for even if one person is been thinking about it, it can feel like a lot of anxiety to do nothing.
Absolutely. Like there's such a focus so often on behaviors. We're looking for that behavioral evidence of they get it. They're going to do different now. We want the person to behave in that role that we want them to fill, so that we can fill the role to them that we want to fill as well, like you said. And not knowing what can I do to fix, air quotes again, fix this, can be so anxiety inducing for people. So being able to give that sense of here is exactly what you can do. And again, putting it out as like, here's what I'm going to do. I'm not telling you, call me back on Monday. Don't call me again until Monday. That would be a demand. Or call me on Monday would also be a demand. But me saying, I will reach out to you.
Yeah.
Gives them a less indefinite experience of anxiety as well.
I kind of wonder, and I'm always cautious here because work with a lot of assigned female at birth people and a lot of my fellow LGBTQ people, and there quite often is scenarios in families and romantic relationships, and sometimes even in friendships, where the AFAB person is doing a lot of emotional labor. So how do we help support those clients who are exhausted by the level of emotional labor that they are doing, sometimes in their family structures or in their relationships, their romantic relationships? How do we help them, I don't know, have some Gatorade in maintaining these boundaries? Because they can be really exhausted by the level of emotional labor they have to put into boundary setting.
Absolutely. And honestly, that is actually spot on what the fourth step of boundaries, compassionate boundaries are, which is self-soothing. It's how do you look at, or asking yourself, what are my current emotions about this boundary, about setting this boundary, like the process of setting it, about how it's being received, like being able to identify the emotions and then being able to give yourself that compassion that says, well, how does it make sense that I feel those things? Being able to validate yourself of, yeah, if I have been this person's go-to emotional support system, and now suddenly I am intentionally not filling that role for them, of course that's going to be distressing for them, and potentially, of course, it's going to be stressful for me, because now I'm sitting here thinking, who am I instead of their emotional support system? What role do I fill instead of that role? And of course, that's really scary. That is also a very real question. Who do you want to be to this person? Or what does emotional support look like that is not taking on their emotions? What are the reasonable boundaries even around that? Self-soothing can also be, what does my body need right now? Do I need rest?
Yeah.
Do I need food? Do I need to move? Do I need to cry? What's the physical state of comfort versus discomfort? Because I don't know about you, but I can also be honest with myself that I behave, think, and feel differently when I am physically uncomfortable. When I am any of those things, or when my body is feeling my temperature dysregulated, or when my clothes are too tight, or if I haven't showered recently enough to where I'm feeling physically just grimy, I will interact with the world and the people in it differently. And so part of self-soothing is also checking in with your body about what it needs. It's also fair to check in with what your heart needs. So this is something that I call a lot of compassionate self-reflection, where we need to be able to be honest about ourselves, like I said earlier, about the feelings around the boundary. Does it feel okay in the long term, even if it doesn't feel okay in the short term? Do the actions make sense? Like, you can even kind of ask yourself, is the boundary about me, or is it about the other person? And being honest with yourself about that. This is also where we need to be able to be honest about recognizing what has been my role in maintaining the problem so far. And I always want to make sure that I say, especially in consideration of the AFAB population, this is not at all to say that responsibility is 50-50, right? Like, I would not in my wildest nightmares tell somebody that it is a 50-50 split responsibility between the people that are involved in a problem. Especially not when you think about things like abuse, especially not when you think about cross-generational experiences between a parent and a child. That this is the example of influence, right? Like, it's being able to say, I know that I am an influence here. How can I be honest with myself in recognizing how I am influencing this dynamic? And if you notice a lot of self-criticism in that process, we can be compassionate about that too. Like, I love to highlight any time that we aren't compassionate to ourselves is an opportunity to be compassionate to ourselves. If you've always been critical to yourself before, of course that's the first place your brain is going to go. Self-criticism.
You're nailing something that I think is really important, especially for the AFAB population. When I'm working with so many of my clients, and you said the new role creation, what does that look like now if you're not going to play the role of emotional support human for these family members or your romantic partner? What will it look like now? And if it is your romantic partner and it has to do with eroticism or your own sexual desire, one of the things that I think we have to look at with our AFAB clients is, what is it in the past that has influenced that role creation? And part of that role, like the deconstructing of that role, is, oh, okay, like I watched my mom play this role with her partner. I watched the women in our family play this role. Sex was not on the table for any of us. Grew up in a very religious household. Eroticism is shame
about it.
Yeah. Correct. So creation of that new role, I don't want to speed past that too far, because I think that that's where so many of our clients get hung up, is this, what now?
Absolutely. Because it can be both, or either the creation of a new role or redefining how to fill that role. Like, if emotional support has historically been, let me take care of it for you, we can change that while still offering emotional support to that person. Like, we can still offer that validation of, yeah, that makes a lot of sense, that feels really hurtful for you, without then rushing off to that other person and saying, hey, you need to go, say this to this person, like, you need to go make nice with this person. That's not what emotional support has to be. It can be the, like, kind of like what you were describing, even about therapists and their clients, of, it can be us being with somebody emotionally without taking on those emotions, still being able to distinguish my feelings and their feelings.
Yes.
And that's still supportive. Just because it's a different type of support doesn't mean it's not supportive.
Yes. And the nuances that we are having to teach our clients around, I mean, it is the entire reason the therapeutic relationship exists, but the nuance that we are teaching them, I just want to say to all you therapists out there, especially you new ones to the field, like this takes a long time to understand, and it takes a long time to really understand your role as the clinician in the creation of these boundaries, and how do they do that with you, and how do they do that with all of the people in their lives. I'm kind of curious, do you have a case example that of some folks maybe reconnecting after a cutoff, and I am sure there were some wins and some fails in that process.
Yes, and for the purpose of hope, I will absolutely cover. I want to provide an example of a win, if I may. I can also provide an example of one that I can't call it not a win because I don't have an in picture. I guess that's true of all cases. But I was working with a family, and I'll give substitute names just to maintain confidentiality and not provide a lot of details along the way. But an adult child, who I will call Britt, had reached out to me wanting to figure out how to have a relationship with her parents after she had cut them off. I'll call them Linda and John. So she, a few years earlier, had heard about John behaving in a way at their successful family business. She had heard about him behaving in a way that she viewed as problematic. And she was disappointed with her mom for not making a bigger deal about it, kind of seeming to let dad get away with it. And this was really more of a last straw specific incident that had led to the cutoff at that point. And
that
she
long
really
progression.
Exactly
Cataloging that long progression.
She's been keeping those receipts. And she brought them to therapy too, I will say. So she at that time ended her relationship. Britt ended her relationship with her dad, John. These are both her biological cishet parents. And that was also at the cost of her relationship with her mother. She really, like the family really had this impression of all or nothing when it came to you can't have a relationship of one type with one parent and another type with another, or with one parent but not the other. And this also meant cutting John and Linda off from their grandchildren, which they also, frankly, had some resentment to Britt about. So Britt called me, like I said, because she really wanted to have some confrontational conversations with her parents, and just really wanted to fix the relationship, but also had no real idea of what that meant and looked like. I could really tell as she was even contacting me from the very beginning, what she really wanted was to feel heard. And so I started working with the three of them. When I work with a family, I alternate between meeting with the whole family versus meeting with pairs within it. I do this to address each relationship within the family. This is a marriage and family therapist thing from family systems theory, that therapy addresses both the health of each individual person in the family and the relationships between each pair, each triad, and so on. And so I've also really noticed over the course of the work that I do that those paired sessions are really where people seem more willing to go to express their emotional vulnerability, because they're getting to talk about and in a way kind of isolate the emotions that they have with and toward that specific person. So like, for example, Britt would let her guard down earlier in therapy when meeting one-on-one with her mom, which helped her feel more emotionally safe and supported in sessions when her father was present. And so they still influence one another along the way, but the meeting in pairs really seemed helpful to taking care of those specific relationships too. Over the course of working with them, all three of them really did a great job at setting and maintaining multiple boundaries. And they did not go smoothly. Don't get me wrong. Like, it's not like they set them and instantly the other people received them. There were some ups and downs along the way. But Britt left the family business to go do a similar job somewhere else. Linda really learned to set boundaries between her professional position over her husband versus the role of being a spouse. John really learned similarly to step away from making assumptions about a person's personal choices based on their professional choices. And he really stopped waiting for others to change. And he eventually was actually one of the first ones to bring his guard down and apologize to Britt, which of course helped her open up substantially. Linda decreased her behaviors of emotionally coddling John and really learned that she can have an independent relationship with Britt. And she really stopped what family therapists called triangulating herself between the two of them, being that kind of emotional support fixer, like you had said. She had previously tried to fill that role, and it had ended up helped to where she didn't feel good with either person, and she had just withdrawn entirely. And so now she was finding, I can have relationships with both of them independently, and even all three of us together, without being that kind of docile fixer. So through all of this, all three of them also took the time and space to reflect on and acknowledge their roles in the problem, like I said, and even apologize for those. So this included like acknowledging they all wanted to reconnect. They all wanted meaningful connection, and they all wanted to also be seen as autonomous people, and really being able to give the space for that as a therapist. I reiterated over and over again, like, you are all on the same page. You all want the same thing. We're just figuring out what that actually behaviorally looks like, but you all want to feel connected and safe. We were also able to pull apart some generational trauma and compassion towards that, like recognizing the parents' childhoods that had included abuse and neglect impacted how they had parented Britt. And then they were, even when they were attempting to do different, they were also able to offer compassion to their parents that were raised in abusive environments and had been abused in their upbringing. We really leaned into that idea of we are all better listeners when we feel heard. Like once Britt received John's apology, it was almost an immediate switch that she was more receptive to acknowledging her role in the dynamic as well. They actually, after quite a few sessions, they did hit a rough spot, because John was still, at that point, he had asked for something from Britt that she wasn't ready to give. And so she requested that we pause therapy. And during that month, she came back afterwards and said that she really had a revelation from the experience around boundaries, that she wanted to put relationships before rightness, but that included her relationship with herself. That idea of, I don't need somebody else to tell me that I'm right. I can know pieces of that within myself, while also respecting, I want the connection with this person more than I want them to do things my way. And so that
sounds like emotional autonomy.
Oh, you would think, right? And so, like, as we were doing the work and we were building their boundaries, some of the biggest differences that happened really were a shift in the boundaries over time. So early on, the boundaries were more restrictive. Early in treatment, literally the family only interacted in session. There was no contact among the family members outside of that hour a week. Over time, Britt felt okay to meet with Linda independently, like they met at a coffee shop. Then later she was okay with meeting with both parents if her husband was also present, also in a public space. And then eventually met briefly and in an outdoor setting. They used the language of like neutral territory with John. They went and walked their dogs together. And so they described, when she saw her boundaries being honored by her parents, she became more flexible in those boundaries and more open to it. So the last meeting that we had, trust was being built, and autonomy still respected. Like it was trust, it was autonomy, and it was also a decrease in personalization, to where if somebody, if they usually walked their dogs, maybe we'll say 3 times, or walked their dogs together 3 times a week, but appointments just so happened that 1 week it was only once, both John and Britt were able to know we're still okay. We're still on the right track. This doesn't have to be viewed as a step backwards, because it is such a situational shift, and we can get back to the frequency we want without having to view this as a hiccup. So last time I saw them, they were talking about wanting to get Britt's brother more involved in the healing as well. He had initially refused to be part of the therapy, didn't really think he was involved, which, as family therapists, we all look on and say, more than you know, buddy. But really wanting him to see that healing could happen, and to foster that safety with him too. They actually, last I heard, they were having weekly meals together, including the children, and had a running group chat for the first time ever. And I really couldn't ask for a better outcome than that.
Beautiful. Beautiful, beautiful. In light of this case and all of the things that we have already talked about, what final advice, insights, anything that is left over, because this is a wild world that we are supporting our fellow clinicians in, how would you support folks rejoining after cutoff and setting compassionate boundaries? Last thoughts.
Yeah, give it time. There is not a set timeline for this process, and there can be a lot of healing and untangling of hurts that happens along the way. Compassion helps always, being more than understanding, but overtly present with your own emotions and perspectives, and potentially those of others. And I guess kind of tied with that is go to therapy if it is possible. If it is not an option, see what books are out there, see what is at your local library. And if there are specific recommendations, like I'm a believer, perhaps in my own practice, I should only speak to, if people reach out to me and ask for book recommendations, I will give it to them whether they're my client or not. I will post it on my website. For people that therapy is not readily accessible, I still want to be able to say, here is something that helps. So if it's possible to go to therapy individually, potentially family, absolutely, it is an investment worth making.
Personal conclusion for yourself. I'm kind of curious, personal conclusion for yourself. What has doing this work taught you about maybe your own relationships or your own relationship with yourself as a clinician?
My relationship with myself? Ooh, you're asking me this so close to the end. Gosh.
Hey, like our clients like to do 5 minutes before we're done with the session.
They're like, oh, by the way, I would say that this work has really taught me to appreciate the complexity that is life, and that is not unique to me in a harsh way. This is the human, gosh, what is the word I am looking for? This is the human plight, is a constant balancing of autonomy and that sense of meaningful connection, and that it will constantly be in flux. And that is okay. That is normal. And that it is not the expectation that you find the forever solution, because you are not going to be the same person forever. It is far, far more helpful to let things be temporary, and to be open to yourself to know when change needs to happen.
My goodness. That part of change is going to happen. As a clinician, especially when you're first starting out, or when you're first working with families, or you're first working with couples, understanding that change will happen. It will, good or bad, like it will happen.
Natural or not natural, it's going to happen.
Dr. Bethany, you are a lovely friend, and I'm so glad that you are such an integral part of 2X Labs. Y'all, go check out Bethany's work. How can people find you in the world outside if they're referring clients to you?
That is a great question. Like I said, you can search my name, Bethany Suppes, Suppes, spelled like supper, but with an S instead of an R, and not pronounced the same for whatever reason. Based in Spokane, Washington, my practice is called Solutions Through Compassion, which will be no surprise to anybody that just listened to what I talked about for the past hour. And then, as you mentioned, I'm also involved in 2X Labs and working on building a more of a social network presence. So as I get that going, this answer may change for interviews.
It's totally fine. It's gonna, change is coming, like we said. Exactly. So thank you, folks, for joining us. Please leave us feedback about other topics you would love to have CEs about to support your AFAB, that's assigned female at birth, clients. You can find us on Facebook, YouTube, and Instagram. Maybe others in the future. We don't know. We'd love to see you there. We will see you